Well, today Ghana has stepped up the fight against the deadly coronavirus disease as it sets up a fund to deal with any possible spread into the country. To start with, government has already allocated 2.5 million cedis as seed money for the fund. He's briefed Parliament as the Minister for Health has briefed Parliament today about the country's preparedness at all entry points. We'll bring you details of that interaction in Parliament shortly. But on the ground, health officials have been getting tough on passengers as they are vowing to hand over passengers who fail to cooperate with port health officials in implementing measures at the port. Fred Smith was part of a group of journalists who were given access to the airport as Ethiopian Airlines passengers arrived in the country today.
So this is the Kotoka International Airport, one of the country's points of entry, where surveillance systems have been enhanced to ensure that the coronavirus outbreak does not spread into this country, or at least if it does, it is contained in a very timely manner. We're here today on a tour of what has been done at the point of entry here at Kotoka International Airport, and Ghana Health Service officials and port health authorities have been explaining to us what measures are in place. And as you can see behind me, there are passengers coming in from Ethiopia, and Ethiopia is actually a transit point where persons traveling from China into Ghana will have to go through. And so we expect that some passengers from China would have traveled on that flight which landed just a few minutes ago. What they're doing is to go through formalities to check if they are healthy before they are allowed to exit the Kotoka International Airport. So first of all, they are given a form to fill to indicate what their health status is as they know. They are also to indicate how they can be traced beyond the airport. So once they've gone, health authorities will like to be able to track them in case they detect a problem later on. So all of that information will have to be on the form. Then you can present this form at a point where there's the scanner. The scanner will detect your temperature. If your temperature is above 37.5 degrees Celsius, then it will indicate to them that you are not fit to exit the airport. They will detain you. There's a holding bay right here at the airport, and that's where you will be kept until you are further assessed. If you pass that assessment, you'll be asked to go. If not, you'll be sent to a facility at the Rage Hospital or Tema General Hospital. That's where health experts will do further analysis on you.
Called non-contact thermometer. And we use this one if we want to re-interview the traveler. These ones, we call the number thermal scanners. So when you stand on the red light, it will pick your temperature. And if it is above the 37.5, it will show red. You see, this one is green. So one of you can cross. Now, you cross. You watch. No, stand on the line first. Okay. Then it will pick. You stand on the line. It will pick your temperature. You see, so you can cross. You can go. You see, it's showing green on the screen. So if it is above the 37.5, that is above the threshold, you see the red line there. Then quickly we have to isolate you from the rest of the travelers and escort you to the holding room.
If you can just tell us what's on it, what information?
We have health questions on it, health questions.
What are some of the questions? Some
of the questions. Have you had close contact with sick person within the 14 days? Then we ask you, please tick if you have any of the underlisted signs and symptoms. That is fever. And here, that is why we are concerned about the thermal scanners. Fever is one of the indicators of illness. When you are sick, your temperature will go high. So when your temperature rises, that is the term we use as fever. So that is the first indicator before we do further interrogation. Then apart from that, we also do visual observation. When they are in the queue, you see the officers, they will be observing the travelers. So sometimes when somebody is coughing or you are shivering, they will see it. So we are not basing our checking on the temperature alone, but we look at these signs and symptoms too.
Well, one of the measures introduced here at the Kotoka International Airport to help passengers avoid contraction of this disease is also to display information on the coronavirus disease. So it tells you what to do to stay safe, what to do if you suspect you may have come into contact with a surface that has that. It has this information also displayed here at the airport. apart from the screening that persons will go through before exiting the facility.
A National Coordinator of Port Health, Dr. Dennis Laye, has also been responding to questions from the media about this disease.
If you pick somebody with a disease condition, or there's a flight with somebody who's ill, or in the other countries, for example, they've decided to go pick their nationals who are resident in those countries. So those ones, when they are coming, they decide to quarantine them. In the UK, for example, they have about 98 people or so in quarantine. What it means is that their movement is restricted. They can't go out. They stay, they make provisions for all those things. We haven't had any group like that come to Ghana yet. And I'm sure if we get to that, where there's a chartered flight bringing people from the epicenter of the outbreak, similar measures will be put in place in Ghana. Us as health workers in this country, our responsibility is the activities you are seeing here. So anybody who comes here, we have to make sure that the person doesn't put the general public at risk. As for who comes in and how they come in, it's not a decision the health sector makes. I know I've seen it on social media in a lot of places, but it's wrong. It's not in any way preventive. The preventive measures are clear. We have all covered our noses here. So if any one of us has a viral infection in our noses, if we breathe out, it doesn't go to anybody. Okay, in the same way, if somebody on the other side coughs on you, for example, you don't get it. So we need to educate the public on the preventive measures and the fact that if you have any of the symptoms, there's a fever, there's a sore throat, cough, difficulty in breathing, go to a health facility. If the person has traveled to China or any other place where there's been the outbreak, that information must be given to the health worker so that they know what we could possibly be dealing with. I have to say this, there is no cure for this disease condition. So prevention is our only weapon, and we need to drum that home to the general public. People need to wash their hands. If you're coughing, cover your cough, either with a piece of tissue or a handkerchief. Let's wash our hands. As you can see in the airport, we have hand sanitizers all over. We're encouraging people to use this. Have one for yourself personally so that you can also use it, because
prevention is all we have. In the last few minutes, Health Minister Kweku Agyeman has been addressing the media, and we'll take you there for that briefing. But earlier today, he briefed Parliament on the country's preparedness. Listen to that session.
In the area of coordination, public health emergency management structures at all levels, national, regional, and districts, have been activated and placed on high alert. The National Technical Coordination Committee, which is multi-sectoral and multidisciplinary, with experts from the Ministry of Health, Ghana Health Service, the World Health Organization in Ghana, Veterinary Services Department of the Ministry of Food and Agriculture, the Oguchi Memorial Institute of Medical Research, Immigration Service, security agencies, the Centers for Disease Control and Prevention, among others, has had 3 meetings during the period. The Ministry of Health and Ghana Health Service have sent alerts to all regions and districts to activate the respective public health emergency management committees. Stakeholder engagements have started, and we have actually met the authorities of Kotoka International Airport, Tema Port, and Ghana Airport Company Limited. Furthermore, Mr. Speaker, we have held a meeting with the Chinese ambassador to Ghana and discussed issues related with regulating high-risk travels to and from the affected areas in China. The Chinese ambassador indicated that China is doing best to contain the outbreak and indicated no Ghanaian in the affected area is infected. He described the preparedness of Ghana towards the outbreak as highly professional and suggested against mass evacuation of Ghanaian nationals in the affected areas. The World Health Organization also holds this stand against mass evacuation. Active surveillance within the country as well as the points of entry has been enhanced. Mr. Speaker, case definitions have been developed to help clinicians detect potential cases and manage appropriately. We have sent alerts to regions, teaching hospitals, and points of entry on the outbreak. The alerts also detailed clinical features of the infection and gave guidance on prevention. Sensitization and training of healthcare workers and all other frontline staff, especially at the points of entry, court health, immigration service, and training of staff at the designated treatment centers have started and are ongoing. Large-scale awareness and training of health workers are also planned for immediate rollout. Just that we have taken measures to enhance screening at the points of entry, especially the heavy traffic entry points. We are screening for fever using walk-through thermometers and non-contact thermometers at the Kotoka International Airport and other designated points of entry. Efforts are underway to ensure that all the points of entry have non-contact thermometers. We are also using a health declaration form to extract salient information from travelers to assess their risk profile. Currently, the declaration form is applied to all international flights at Terminal 3 of the Kotoka International Airport. In respect with laboratory confirmation, Noguchi Memorial Institute for Medical Research has demonstrated capacity to conduct tests for confirmation. For case management, Mr. Speaker, we have designated treatment centers.
So that is the Health Minister there announcing to Parliament what our plans are. In our subsequent bulletins, we'll break it down for you and we'll give you more details on how Ghana is preparing to keep itself protected from that deadly virus. Like I said, between the last time we did the show yesterday and now, over 100 people have died. 111 people have died. So do protect yourself. Keep washing your hands. If you're coughing, cover your nose and just make sure that you're safe.